Well, it's an age-old worry for parents, kids swallowing things that they shouldn't, but there's a new study in the Journal of Pediatrics that says the rate of foreign body ingestions among children under age 6 nearly doubled in the 2 decades following 1995. And some of the biggest culprits, well, some are old, like coins and toys, but some are new, like button batteries, and those can prove to be deadly. And Dr. Robert Kramer is the co-medical director of the Digestive Health Institute at Children's Hospital, is joining us now. So what type of cases are you seeing? Just by the mention of these button batteries, I guess you're seeing them more frequently now.
We are. We actually get calls almost on a daily basis about someone in the 7-state region that we serve having a child with a battery ingestion, as well as coins we pull out on a daily basis. And magnets, I think, are the other really big, dangerous player that we're seeing more of now.
Talk about the button battery and what it does if it is in fact swallowed by a child or by anyone.
Internally, yeah.
Yes, I mean, these can be particularly dangerous because what they do is discharge, and typically if they discharge within the esophagus, they actually induce a chemical injury to the esophagus that can erode through the entire wall. And in the chest, there's a lot of important structures there. The one we worry most about is that it erodes into the aorta, the largest vessel of the body. And if that happens, that's almost uniformly fatal. And so, unfortunately, we have seen deaths from otherwise totally healthy children because of this tragic ingestion.
You were telling us that these batteries are actually getting better and better all the time. They're made better. I mean, they are in greeting cards, they're in little tiny toys, they're in all kinds of little things, and we know kids can find them no matter what. What does a parent look for, though, in case they suspect somebody has swallowed something? Because you'd want to get help right away.
Sure. Certainly a certain number of these ingestions are witnessed, and that always helps because then we have a time point to know, when it actually happened. But you're absolutely right that it can be tough for a parent to know. I think there always has to be an index of suspicion if there's sometimes pretty common symptoms such as chronic cough that's just really not getting better. In a toddler, an ingestion always needs to be on our mind. But as well, choking, gagging, difficulty swallowing, decreased feeding, all in toddlers. Obviously, they have a more difficult time telling us, I'm having pain or I'm feeling something stuck. And so it really does keep the onus on us as caregivers and as parents to keep our thoughts on that.
I was surprised. We were talking in the break, Dr. Kramer, about the time frame, because I tend to think of something being swallowed sitting in your stomach and then slowly creating maybe a poisoning problem or something. You say with these button batteries, the clock starts ticking immediately upon them being swallowed as far as what they can do.
Yes, absolutely. I think with coins, we usually say a coin stuck in the esophagus, the swallowing tube, our clock is about 24 hours before there can be usually significant injury of erosion through the wall. But for button batteries, that clock is really as soon as 2 hours. And they can be very difficult to remove if they're really a fully charged new battery. Those are certainly more dangerous than a discharged older battery. But the newer batteries, in general, as you were saying, they work better. They have twice the voltage of the older non-lithium batteries, and they have a much longer shelf life. And so even when they're spent or dead batteries, they can really cause injury. So we do worry about those sooner.
It's again a reminder, parents try and look at everything they can, because kids can find it no matter what it is. The little ones are, they're pretty crafty.
Now, our own 9 News medical expert, Dr. Camilla Sasson, had a very scary moment as well this weekend. Recently, her 2-year-old daughter, Madeline, swallowed bits of a Kind bar with dark chocolate and some nuts in it. And at first, she thought it was okay, but then Madeline started to experience that barky cough.
What you just talked about.
So she decided to take her to the ER, some x-rays, and a trip to Children's Hospital in Colorado. A full-size peanut was removed from Madeline's right lung. Now, Dr. Camilla shares her experience in a story on 9news.com, and I guess the advice is always, if you suspect something, go get help, because the experts can determine where or what might be lodged in a child's body.
Yes, certainly it's easier when it's an object that shows up nicely on x-ray, like button batteries and magnets and things of that sort. But yeah, certainly besides GI tract foreign objects, there can be foreign objects in the airway as well, and our colleagues in ENT and in pulmonary certainly see their share of those as well.
Okay, something else to think about and worry about. That's what our job is as moms, to worry, and dads too. So anyway, but important information to share. Thank you so much for being with us, Doctor. Yeah, and Dr. Kramer, and we will be right back.